Okay,
Thank you
thanks,
so much,
thanks,
sir.
Vikram. We are going to take some questions. So I'll just tell Modaliye Soli Ranga. So, what is the cause for PD, PD dementia? Konjo and the madri medical idla inniki nanga pogala. We are not going to explain those things today. Just keeping it more to Ayurveda and Parkinson's. Please take the mic. More questions directed. I'll just go with Dr. Sudheer's questions first. Is it okay? Well, simple. I'll start. Is Vata worsened by raw vegetables? Yeah. Vata, does it increase due to eating raw vegetables? Yeah.
Yeah, it increases with raw vegetables, raw salads. Vegetables as such, actually they increase vayu. So, especially the roots and the like potatoes and yams, all these things, they increase the vayu more than the other vegetables. Watery vegetables are more preferable, and tree vegetables are also good, but that's why the vegetables have to be processed with some ghee or oil to reduce the intensity of its impact on the vata.
Doctor, another common question is, can Sindopa, the allopathy medicine, be taken with Ayurvedic medication?
See, in my practice, see, there are no studies that it's been happening with whether Sindopa can be taken, but it's only a supplement that's happening. There are no known interactions with any of the Ayurvedic medicines. And if there are other complications of other medicines they are taking, we need to be careful with that. So Ayurvedic medicines, they are like herbs only. The herbs are like just like a food only. They don't interact with chemicals, but preferably we ask them to space. Don't take allopathic and Ayurveda at the same time. You need to have at least a space between these medicines so that the efficacy of each medicines are not disturbed. Okay, so the Ayurvedic medicines work like food. They have to get digested, and then only they start acting. It's not like they enter into your bloodstream and start working. So the allopathic certain medicines, like if they are taking thyroid, we ask them to take first the thyroid. It will get absorbed first. Most of the Ayurvedic medicines will be on empty stomach for better efficacy. So you just have to space between them. That's all. But you can take allopathy and Ayurveda together. Certain drugs, like if you're taking on some immunosuppressants, other things, we ask them to stop for a period, like on steroids or certain medicines. Otherwise, Sindopa, these medicines are safer. They can be taken along with Ayurvedic medicines.
Doctor, if they have to get Ayurvedic medicine, should it be treated as an inpatient facility?
See, certain treatments like Vasti or bigger Panchakarma cleansing treatments needs in-house. Otherwise, like the Pirichal or the Shirodhara, all these things can be treated at outpatient itself. See, the treatment for PD is going to be a longer process, just like yoga or therapies and all. It is not like you take it for 15 days or 7 days and you're going to get better. It depends on the stage. Okay, so if it's mostly it's going to be like a maintenance, like once in 3 months or once in 6 months or once a year, depending on the stage, and it can be done as an outpatient.
Okay, thanks, doctor. So one of the members here is asking, the father is taken to bed and it's very difficult for him to walk. So can Ayurvedic medication or treatment help?
He's in the bed.
Yeah, he's taken to bed. 4 years taken to bed. Is there any scope of him to make him walk with the oil massage?
See, it definitely at any stage the medicines are going to work. Okay, so whatever way it is going to work, or we cannot expect a reversal at that age. It depends on the age and a bedridden person. But definitely we can improve the quality of life, like improving the bladder controls and the other uneasiness what the bedridden patient would be undergoing. Definitely we can work on that.
One question to Saraswathi. How do you customize your yoga treatment to people? I think that's what your presentation was all about, but just in summary.
Yeah, so we do a thorough assessment of the person through observation, through asking questions, recording all the information about the person, what their major symptoms are, possibly looking at what could be the causes, what are the active causes, what is the diet, lifestyle. We try and understand everything, even their family context. And then we do some tests to see what kind of practice to give. Like what kind of asanas can they do safely? Can they do standing? Can they do seated, lying? First we try and understand, choose a few postures, modify them for the person, teach them with the breathing. And it is a long-term process. Okay, it's not like you come for a symptom, get better and you stop doing it. It is a chronic condition, so we need long-term intervention. So the practice itself is adapted to the changing needs of the individual. And ideally, we see a person once a week. We give a practice that we expect them to do every day at home. Sometimes we may have to see them more than once a week. We also do online consultation and classes.
Doctor, can Parkinson's be cured?
Cure is a big terminology. I cannot assure you that. But the possibility of healing lies within. The cure,
Well, how do you differentiate between curing and healing?
healing is a process. Healing is a process. It's an ongoing process, just like the flow of the river. Body always moves towards health, never towards disease. Body is designed for self-healing. And what is the physician and the therapist are doing? They are only giving a helping hand. The body is able to get up, it will get up.
So just to reiterate here, PD is not in Ayurvedic terms, but in allopathic terms, it's a neurodegenerative disorder. Cure might be a very big hope for Parkinson's, but good management of Parkinson's with appropriate Ayurvedic treatment and yoga practice is possible. Yeah. Doctor, if somebody has arthritis, will they have more chances of developing Parkinson's?
See, both come under the Vata spectrum, but the tissue levels are different. So they need not. But if both, if it happens in the same person, the recovery becomes difficult because the approaches are different and the choice of medicines are different. So because both are Vata rogas. So a person has a tendency towards more Vata roga means he's in the bigger spectrum. Then the possibility of recovery becomes difficult. If a person comes with arthritis and PD, I usually start with the arthritis first because that's more problematic and it involves multiple things because it's more faster progressive than the PD when it comes to an old people.
Doctor, one more final question maybe. Constipation is a big deal in Parkinson's. So what kind of food can be avoided? A member is asking, should I take wheat? Should I not take anything with wheat? Will that aggravate my constipation?
See, the wheat has been a big challenge in many conditions and it is connected to the food. The reason is because of the current wheat, which is the dwarf wheat, the hybrid wheat that is coming. But in the traditional wheat, we don't see the problem of constipation happening there, which is only 20% of India's production there. So maybe, the other foods which add to the constipation are the Vata aggravating foods. Just like I said, there's sprouts and raw salads and more of spices like chilies and added to that. Those kind of foods without oil or ghee in the diet. You just boiled vegetables and that kind of things will going to add to the cause. If you can avoid those things which aggravates the vayu and also include more of fat in the diet. So the healthy fat like the coconut oil or the ghee. So those things can definitely improve the bowel movements. Instead of, you see, in PD and in old age, the problem is because of the dryness in the gut. There is no point in taking laxatives. It is going to further aggravate and the patient becomes dependent. The stronger dose they will be on and there's no relief. The more is to lubricate the gut. That's why, in PD and similar conditions of constipation, enema is indicated. Take oil enemas on a regular basis. That will, you can skip levels and lubricate the gut even faster than taking months and months of internal medication. Those things can be planned.
So foods to avoid: raw food, salad, too much of millets, anything dry. But if they take a lot of ghee and coconut oil, will that not lead to cholesterol? It's a commonly asked
It's a good
question.
cholesterol. Ghee and coconut oil add only good cholesterols. Of course, it should be taken according to your digestive capacity.
Saraswati, one question for you, although I think you addressed it already. How long should somebody with Parkinson's practice yoga?
Yoga Sutra says Dirgha Kala Nairantarya, long time without interruption. You have to make it part of your lifestyle. It's not like medicine. No, it has to become part of your life.
Somebody wants to know, how do they check Vata, Pitta and Kapha in their body? I don't think you can check, sir. Doctor has to check. What do you say? Or maybe they can check? I
Yeah,
don't know.
yeah, you can check yourself.
Okay.
See, there are a lot of questionnaires available on the internet. You can fill those questions and, identify.
Are you serious?
Yeah, serious. See, basically,
And that
basically,
will tell us whether I'm
see,
kapha.
most of the time, you can check through your nadi also. That has to be on an empty stomach on early in the morning, before the onset of hunger, everything. See, you can check yourself. You actually know what your prakriti is. See, if, it's available on the internet, the list of vata symptoms according to the prakriti, vata, pitta, and kapha. I'll give you a simple example. Like constipation is a sign of vata increase. The vata prakriti, it's part and parcel of their life. If a constipation doesn't bother a vata prakriti, they will say, I've been constipated for 2-3 days, but it's okay, doctor. Right? You don't have to mention, you don't have to give any prescription for that. I'm comfortable with that. 2-3 days of constipation. But if you say a pitta person, he will keep coming to your clinic every day till the constipation is relieved. He said, it's bothering me, doctor. I cannot even work. I cannot think anything. I cannot, do any work. It's just bothering. The constipation bothers. Something which bothers is not your prakriti. The imbalance you are comfortable with is your prakriti. You are short-tempered, you shout, you are happy with shouting, that's your prakriti. It's a pitta prakriti. Okay. You are happy sitting in the same seat. If most of the kapha prakriti will be happily sitting even after the session is over also. But vata prakriti, before we end the session, they'll be up. And the pitta prakriti will be thinking, what this guy is keep on talking nonsense, when will he stop all these things?
No laughs for this. I wonder why. What are you all thinking? Okay. Okay. Okay, good. I don't think we can technically answer this. Is dementia and Parkinson's interconnected? Do you want to give an Ayurvedic sort of angle to this?
See, I've seen in my practice both are happening together, but both are two different spectrums in Ayurveda. A person with the Kampavata need not get a dementia, but both are possible because both are Vata Rogam. If they come under that spectrum, then possibilities are there.
So usually that's not the case from what we have seen. Not everybody who has Parkinson's goes on to develop dementia. But there are some cognitive issues for sure, and there is age related and also depends on the type of Parkinson's that somebody has. Saraswathi, one interesting question for you. Yoga being a spiritual practice, can we understand that the treatment that yoga gives for PD is a faith-based therapy?
So Yoga Sutra does not talk about any particular religion. But faith is important. That there is something which is beyond this physical body and what you can see and experience. What has created this body? What is that intelligence that governs all of nature? Is there a curiosity about it? Is there a certain kind of reverence about it? That I would call spirituality. So if I have faith in something which is beyond me, that I know is far more intelligent, and I can anchor myself to that, and that will guide me, that will give me the direction for my life, that I would call spirituality, and that is what yoga looks at. So I don't think it is referring to any particular faith. It is for everyone. It is universal. Yeah. But depending on the faith of the individual, we can tailor the practice. So somebody comes who, let's say, a staunch Hindu, we may give them some chanting, some practices, some connection to a particular deity. If somebody comes who's a Christian or a Muslim, then we actually help them to connect with their faith and deepen it. And use the connection to God, to a higher entity for healing. Yeah, because even Yoga Sutra says your connection to Ishvara, what is that you're connecting to, that can actually help you to calm your mind and progress in your path of spirituality. So that is what we have learned from our teacher Desikachar, and that's what we teach.
Thank you, Saraswati. I don't know why I feel the need to explain after both of you have spoken. So it's not only faith-based, right? Anything like yoga, you need faith even in allopathy medicine. You need to have faith that Sindopa will work for you, or the doctor, that neurologist you're seeing is actually a good neurologist who is going to take you to the path of healing. Having said that, yoga is also extremely scientific. The way the body and the breath and the mind works, it's extremely scientific. But you need to have faith on what you're doing. So that's what Saraswati beautifully elaborated. With this, I think we'll close the Q&A. Thank you so much, Hina. We have few mementos to give. We'll call Malati Madam Malavarengla. Come to sir.
Thank you. Please have a seat. Please have a seat. Thank you to our audience for the great questions and to our lecturers for their enlightening perspectives on the questions. It's now time to honor our esteemed speakers with mementos. I invite Ms. Malati Narasimhan ma'am to present the memento to Dr. Sudheer Sreehareeyam. Let's express our gratitude. Thank you, ma'am. I invite Dr. Radhakrishnan